Long story. So when I was a resident, I joined the ESOI, the European Society of Oncologic Imaging, and I was attending an ESOI workshop regarding the tumor response to therapy. The course was an hands-on workshop where you practically are trained to work with workstation and to write a structured oncologic report using, at that time, RECIST criteria. Mint Lesion was one of the workstations over there, but among the other vendors, Mint Lesion was immediately easy, handy, and solid. And it was very consistent between the different time points of oncologic examination, starting from the analysis of the baseline with the different follow-ups. So it was very practical and to segment target lesion and to point out non-target lesion. And lastly, after the segmentation and after the report, you have to write down the response categories, and Mint automatically provide that. And it was great. Okay, so oncologic patients are very difficult patients, not only for the oncologic situation, but also for the physiologic status. So if we are doctors and radiologists, we need to provide them everything. So if patient comes to our department to perform a CT, a stadiation CT, so we need to give them all the possible information. And we need to standardize that. I think we need to standardize the oncologic report because patient may benefit of this kind of report and may need for sure structured report and response to therapy evaluation. I mean, it's not helpful anymore to just write it down a report, but we need to give information, and Mint Lesion can provide that. So we are an oncologic center, so we are using Mint Lesion in the evaluation of clinical trials. That is now mandatory, but due to its simplicity, I'm using also Mint Lesion in clinical practice as a support, in particular for some difficult clinical scene or scenarios, such as like patient with firstly response to therapy, then progression, then stable disease, or for example, high-RECIST criteria that were more difficult. But I think we should integrate it in our workflow, because if you start using Mint Lesion for oncologic reports, it really keeps memory of previous evaluation and everything is simpler and faster. So personally, I'm strongly in favor of structured report, especially in oncologic imaging, and Mint Lesion really help us in that.